I don't always know what I need. You know, I'm looking at what I want, but I don't know how to achieve it. You know how to achieve it.
And I tell you, hey, listen, at the end of the day, this face is my face. I'm not kidding. There's no joking that. I'm being very serious. And so when I'm in the operating room, anything that I see that I think can be made better, I will attempt to make it better. I have Vivian here. Vivian is 4 days after revision, deep plane, face, neck. What else we do? Fat.
Cheek, chin.
Cheek, chin. So I'm gonna share a little bit about Vivian. So Vivian had surgery several years ago, not so thrilled with her results. She had had cheek implants and chin implants placed. We removed the cheek and chin implants stage 1, gave her about 5-6 days, 2 weeks. Okay, 2 weeks to heal, and then we did the rest of the work.
Yes.
Okay, and now she's 4 days after surgery.
Yes.
Okay, so Vivian, how do you feel?
I feel great. I actually feel great. I was scared, but I feel much better than I thought I would, especially having local anesthesia with mouth sedation. I was gonna freak out about that.
So let me give you a little background on Vivian. So Vivian, she told me that, hey, listen, I'm kind of a weenie, okay? She said, and we did her cheek and chin removal under local anesthesia with oral sedation as well.
Yes.
So what that allowed me to do, I needed to do that, number one, but it also served a secondary purpose in that it kind of showed her what it's gonna kind of feel like. And it was a litmus test for us, because if she couldn't tolerate that at all, then we were just gonna do general anesthesia. But she kind of passed that with flying colors. And then so she said, hey, I think I can do the whole shebang as well under local. We did that on Thursday. Today is Monday. So did I torture you?
No, not at all. I mean, there was no pain, there was no discomfort.
Yeah.
I was relaxed the whole time. I got to hear the jokes that, they tell each other.
She actually included some of her own.
Yeah, so if I can do this, anybody can.
Okay.
Because I've done it under general anesthesia, and I kind of like the way general feels, because they put you to sleep, you wake up, and it's done. But I was kind of, I had anxiety even on the way to the office to get it done. I even say, I'm nervous about this. And Dr. Arthur said, well, good. So once I got here and all the medications that was given, it was
pretty easy?
Yeah, it was very easy.
So Vivian is not a very big woman. She's very kind of small framed. So we gave her the medications. She went home. She was kind of gorky when she went home in terms of she was very sleepy. I think she slept probably the vast majority of that first night.
Yeah.
When she came, am I allowed to share how old you are?
Yeah.
How old are you?
I'm 67.
Okay, so she's going on 70. She's a healthy woman, but she's getting close to 70. So when you see patients that are past, say, 65, 66, I know for a fact that some of these patients, even though they're perfectly healthy, can tolerate the anesthesia well. She was kind of a big case. She was a revision case. There was a lot going on. She was a little bit more bruised and swollen than our average bear. So she looked a little puny on day one. We tanked her up with our protocol that we do, our Wolverine protocol with all the light and the IV, which perked her up a little bit. I gave her a couple more days to kind of really perk up. And today she's looking a lot more alert, awake, walking around, kind of doing her thing. She's swollen. But one thing that I'm noticing in her, and then I'll let her kind of comment on it, is that she looks softer. That was one of the main reasons we did her prior kind of did her revision, is the implants made her look a little harsh, very stiff, very over projected.
Yes.
So we wanted to take her back about 25, 28, 30 years to a more softer her. So I'm going to give you, turn over the platform to you. What do you think so far?
Well, when I first walked in, and the first thing Dr. Osprey said, you look hard. I just loved it that he was just so real, because what he said was what I saw. And I saw that it was going to get harder, because as you age, your skin becomes tosus. And then now I have these implants sitting up here. They're not moving. The chin is not moving. Now the skin is draping over that. That's what I had envisioned would happen in the future.
And it was already starting.
It was already starting. The chin began, it was too big for my face, first of all. And it was beginning to look like a little witchy. And I could see it. And, you know, when you put makeup on, other people can't see it. But I got to the point where I didn't want to wear as much makeup as I used to wear. I just kind of want to be natural, a little more natural. And when he said that, I was going like, okay. And then in here, my glands, I guess those are spit glands.
Submandibular glands.
They were sitting out, and I thought that it was because maybe I was trying to get an infection, and they kept getting bigger and bigger. But what I found out is that those
submandibular
glands were supposed to be shaven down some, because my chisel, I didn't have this chisel. I had this, and I had this lump here.
So I'm going to comment on this. It's not that it should be shaved down. That's my opinion, okay? And I just want everyone to know. There are surgeons out there that won't touch the glands at all. They say no, we're not touching it, and I'm not going to debate them. I'm glad that there are surgeons that say, hey, listen, that's beyond my scope of what I know to do and what I'm comfortable with, and they stay the hell away from it. I'm down with that program. In my opinion, you get a chick who is so skinny, so very angular as Vivian was, and if you have that little bit of submandibular gland pooching out, you can see it from Mars.
Yeah.
And she could see it, and and it bothered her, and I could see it from Mars, and it bothered me. So when we were doing her revision neck, we said we're going to go debulk those, and it's not a benign procedure. You know, I mean, of all the pain she's felt post-operatively, 99% of the pain is from that gland removal.
Yeah,
the sore throat.
Yeah, right. That's it.
But it's day 4. That's pretty much on its way out, and so I think that that's a worthwhile price to pay to get that really sharp, defined jaw with no shadow in the neck.
Right. Yeah.
Do you agree?
Yeah, I agree.
Yeah.
Your latter days supposed to be better than your former days. You're supposed to look better. The older you get, the better you're supposed to look.
Like fine wine and cheese.
Fine wine. That's what I plan to be.
Okay, there you go. So we'll follow Vivian along, and we'll kind of probably, she's going to come back in 2 days. Get a little bit more of the recovery protocol. By the way, I didn't ask you that. What do you think about a recovery protocol? You've had a facelift before, and do you think our recovery protocol helps?
Oh yeah, I mean with all the lights and
lights and
what's the name of the machine again?
Hyperbaric oxygen.
Hyperbaric oxygen. It freaked me out because I'm claustrophobic, but I got in it today, and actually she had to wake me up because it was pretty cool.
Yeah.
I mean it's open. I didn't feel claustrophobic. So it was, I mean, everything seems to pull together. Yeah.
So Vivian, your prior surgery, it was about, what, 6 years ago?
No, it was actually 14 years ago.
14 years ago.
The chin needed to come out.
Okay.
The first doctor didn't want to do it. Second doctor went in, and I thought that he had taken care of it, but it wasn't taken care of. So yeah, it's been like 10 years, something like that.
So let me ask you a question, okay? So the first go around you had was probably a pretty big surgery with lift plus implants and all this jazz, right?
Right.
Now you've now had a revision lift, which is from a surgical standpoint, a bigger surgery.
Okay.
Okay.
Yeah.
How do you think your healing is now in comparison to prior?
Well, because I'm familiar with the healing process, the first time I was freaked out because the face looked like this. But the difference is that I was given a lot more care, and when it comes to the red light instruction, I didn't know what I was doing. I was about 53 years old at that time. I didn't know what I was doing. I thought you're supposed to get cheek implants and chin implants, but I learned that I didn't really need that. This time, I think your team works so well together until I'm more informed. The new stuff that he has going on here really make me feel cared for, and it relaxes me. So, you know, when I woke up this morning and yesterday, my face was big as my body. I didn't freak out because I knew, okay,
what to expect.
I know what to expect.
Yeah.
Right.
Do you think your velocity or the speed that you're healing in terms of, yes, you know you're going to swell, but then from the peak as you're coming down, do you think that the velocity has changed? Is it faster or about the same? I
think it may be about the same because I had so much more done this time.
Got it.
Yeah, because it's a revision.
Right.
And because of the scar tissue and things like that, I think by day 4, I think I saw some coming down. Now my lips, I can tell yesterday that they were beginning to come down because they were drying out.
Yeah.
They were so full. But when I start feeling the dryness, like I got a lot of dryness now, I realized those start coming down.
Good.
Because I had never had the lips touched before.
Yeah.
But everything else seemed to be right on track.
Perfect. If you had to talk to yourself, like if I could take this video and go back in time and give it back to yourself last week, what would you say to yourself?
First of all, I would say don't freak out because, you know, it's not as bad as I thought it was going to be.
Yeah.
I think that because of your hands, you know, what you've done and the mere fact that you went in there, you did things that made me feel, when I came out, I felt beautiful when I came out. Believe it or not, that first
Really?
place, of course,
Good.
all the swelling wasn't here and I could see the shape and the form of my face until the swelling popped up on me the next day.
Yeah.
So, I would just say, you know, I would do this again, and if I knew what I knew then, I would be here.
Okay, well, I appreciate that.
I would, and as a matter of fact, I have a girlfriend who's seeking a doctor in her area, and I said, well, why are you going to do that? I got a home here. You can come to I3 and stay with me. I'll take care of it. Then I know what to do because I've done it before.
See one, do one, teach one.
Teach one. That's
there you go.
Yeah,
all right.
I'm grateful.
Well, thank you. So are we. We appreciate your time, and we're going to see you back in a couple days, and I'll kind of put a follow-up out there for our peeps online so they can kind of see how you're doing, because I think, you know, the last couple of weeks for me have been revision after revision after revision, which is kind of cool because then patients get to see, you know, what kinds of things we do and how that impacts how patients heal.
I'm glad I found you on YouTube.
Well, thank you.
I really am, because I was trying to go back where I was and things happened and it didn't happen that way, and I was watching one day on YouTube and I said, wait, that's not the author, he's in Houston? I live in Houston now. You know, so awesome.
It all worked out.
Yeah, it worked out.
Meant to be.
Yes, yes.
All right, awesome possum. We'll see you in a couple days.
All right.
So we got Vivian here. I think I recorded the video last time, which was post-op day 4, and today is post-op day 6. Okay, so just for our viewers, again, who may have missed the first one, just a little recap. She's a revision full face rejuvenation. What we did today, she has had all her sutures removed. She has had her LED light treatment, her hyperbaric oxygen, and she's about getting ready to jet out of here, and I held her up for a few moments to kind of record a little follow-up. So, Vivian, last 2 days, what have you seen as the differential? We saw a little bit of the swelling come down.
Yeah, this morning I really saw the swelling come down.
Yeah.
My lips seem to have settled down. I love these lips. Thought maybe I should add a little bit more lips. But anyway.
So this is actually a common thing, teaching point. So I tell my patients, you know, and she'll confirm this, that I use the word, I call it pornalicious. So when I do lips, almost everybody they look crazy for a couple days, and most people freak out. And I'm very conservative with my lips, okay? I don't like going insane. But nevertheless, okay, after the freak out moment, about a few days later, they're like, can't you make them any bigger? Yeah. You know, this is kind of a, yeah, and I like them a little natural, so. Yeah.
So, but other than that, I have had, you know, no issues, no pain. This the swelling, you know, I can't wait till the swelling goes down, especially this part here. But other than that, I'm just doing normal stuff. Yesterday, I went to the store, I decided not to drive, and I walked to the store, which I don't feel like I've had any surgery. You know, I just feel swollen, but I don't have any pain, any complaints.
So I'm gonna do a little bit of teaching it to people who look at Vivian here. You know, first of all, I give my patients this scarf and some sunglasses. This is kind of their standard outfit, because this is a very common thing for us where patients feel great. They may still have some bruising and swelling going on, but I want them to start getting back to doing their daily activities, and this allows them to be a lot more public. That's number 1.
Yeah.
Number 2, so different patients' bruising, swelling, healing is at different rates. Things that control it, we've talked on multiple times, you know, the anesthesia choice, dissection, all this stuff. But a big factor in this is whether you've had prior surgery. So her having prior surgery before is going to make her bruise and swell just a little bit more. If I look at all my revision patients, they're probably about, maybe in my words, about 15% slower than a primary. And that's just because of the fact that those tissues have been manipulated before. So their drainage pathways, things like that are different. Okay, so that's something to keep in mind. So when I tell patients, for example, if Vivian had never had surgery before, okay, and I had done her probably by about tomorrow, I think she would be almost to the point where she goes, wow, I'm in that fantastic space. I'll put on makeup and do whatever. I think she's got probably about 3 or 4 more days to get to that point. So this is where my timeline kind of comes in. So I'm gonna actually throw Vivian under the bus here.
Oh,
Vivian's
Lord.
kind of cool here because she reminded me of something. So Vivian is the person who's got notifications turned on when I post a new video, okay? And she's one of those, and she told me, I literally posted a video like 5 hours before her coming into the office. She goes, I already saw her, okay? And which is, you know, in a million years, I never would have pretended that was gonna happen to me, that people would be tuning into my videos. But this is why when we do these things, they're so helpful, because Vivian, I'm sure you found some solace and comfort in seeing other people go through this process.
Right.
You know? Now, I'm putting on a series of revision patients next. That's my next goal. Now, as you're going through this process, talk us through one thing. I have a question for you. Okay? Revision surgery is different, okay?
Very.
Okay, because first of all, there's probably a little bit of fear, okay? You know enough to be a bit dangerous because you've had the surgery before. Right? And then to top it all off, most of my revision patients are in this, well, I had surgery and I'm unhappy with certain things, whether it's the practice, the doctor, surgery, the results, whatever. So there's all that put together that we're dealing with, right? So first of all, compare and contrast.
Okay.
And teach like somebody else who's a revision patient, like talk them through it.
You mean what they'll have to go through?
What they have to go through, or you know, what you felt, what you're feeling, you know, because I'll tell you, in about a few months from now, you're gonna forget, right? That's why I'm throwing you under the bus right now while it's still a little fresh in your head.
First of all, the practice itself makes a difference. As I was telling Dr. Autry, coming into this practice, I really felt like, I felt like family, because I didn't come in here to an office where people were just so friendly, just trying to get some business. I came into a practice, and this is the first thing I noticed, that everyone was very professional. However, everybody was not overly, if I want to put it this way, overly nice. They were just people who, when I came in, they greeted me, and they started doing their jobs. You know, there's smiles here, smiles there. You know, Sarah is the girl that's gonna make me giggle. I mean, I'm always coming in here feeling intense because I'm basically new to Texas again. I lived here years ago, but I don't know the area, so I'm frantic because I'm late. I'm almost late, and she just calms me. But other than that, when it comes to the actual honesty, when I walked in, how doctor just said to me what he saw. The revision for me is a little bit different because first time you don't know what to expect, but coming in I expect a certain thing, but that's not the way it's working this time because I'm a revision patient. Like you said, by now my swelling is just about gone. I'm freaking out a little bit because my swelling is still so there. You know, my girlfriend and I laugh at this face. I got a fat face.
You're not used to that.
No, I'm not used to that. By now, you know, by day 4, the first time by day 4, by day 2 or 3, I'm freaking out. But by 4, I was freaking out. But then I found out by day 4, by day 5, my swelling is, I could see myself. But when I woke up this morning, I still don't see myself. But I do see that the swelling has gone down. Things feel differently because he had to do a lot more because there was a lot going on. Scar tissue, I had implants, and all this stuff had to come out. So this is a new experience. It's a familiar experience. However, it's a new experience because things are becoming slower now. Plus, at that point, I was younger, and I don't know if age makes a difference. I have very good health. I was younger, so as you age, you know, you gotta work that thing a little slow. But I'm still
Getting
confident.
up out of bed takes an extra
it takes
second.
a little extra second, even though you don't want to. I may look good and the body looks good and all, but still, it's still there. So I have to adjust my mind to the fact that I gotta, you know, move a little slower and let this thing take its time. I'm excited about the results, what's gonna happen, but I'm still a little bit fearful because I don't want to be stuck like this too long. It's time for this to stop, okay? And that's my experience, but I'm not worried because every time I come in, I'm reassured that, you know, and all the things that have the pressure, the oxygen, the red light, I've never experienced that before. I have not had that opportunity, so the videos help too.
And this is one thing, Vivian, like I am gonna post this video, even though you're like, I'm a little freaked out, I'm a little this, because I think this is real, right? So, you know, when I first started plastic surgery and when I was, you know, dealt with a web marketing company, they would tell me, don't ever put patients that are bruised and swollen on your website. It gives a bad thing. But it doesn't make any sense to me, because if you are going to do this, you kind of need to know what patients are feeling and doing and what to expect.
Right.
And so the one cool thing about this, Vivian, is that I think that to the next revision patient, if they sit there and go, oh, well, this person was back to normal in 6 days, the first question they should ask themselves is that a patient who's had surgery before or not?
Right.
You know, because I'll tell you that, okay, if I have a primary, you know, a newbie, a virgin face, yeah, probably 7 days, I can make them look pretty damn good. Revision, I'm gonna be brutal. I don't know if I can do that in 7 days. I can get you looking decent, getting up and at them and doing your regular stuff, but to the point where you could say, hey, I wore a little makeup and jumped into a restaurant without a scarf or anything, I don't think that that's realistic at this point, despite all the stuff we do with the light and the oxygen stuff. So, you know, if someone has had multiple surgeries before and they say, hey, listen, I want to come down, I want to do surgery with you, I'm going to tell them, hey, listen, you need a good 2 weeks.
Yeah. Well, you know, I believe that one of the things that, as I was searching for a doctor to do a revision, one of the doctors I've seen, have these patients and I see this the first day, maybe the second, first week, and then all of a sudden I see makeup. You know, that's the one thing that I'm going to try to look at when I look at myself, because makeup will cover a multitude of sins, a whole lot of stuff. And that's something that I don't want to just jump in and do. I want to see me natural. I want to see you need to really see the real process. You need to see the day-to-day process, and that the reality of it is that everything is not going to just, like as you were saying, everything is not going to just come around in the next, maybe even the next 5-6 days. You know, it may take a little bit longer, but when you get into this, you really have to have done your research. You have to really do your research with your doctor, for the doctor that you're choosing, and you have to give it some time, because it's just like everybody. Some people have a baby and they say they had no pain. Some people say they had a baby and it's the worst thing that they've ever experienced in their lives. You know, so since this is a revision for me and I've gone through this before, you know, I really would love to come back in the next 6 months, in the next year, so that you can really see the progression. And I would like to come back without makeup each time. You know, I have on no makeup now. I'm not gonna put on any makeup the next time I come, because you need to really see the face. You don't need to see the makeup. You need to see the face and what the face is doing. And there are some things that have been done that I'm excited about, because these surgeries will affect your hairline. And Dr. Autry has done some things that make me ponytail ready again. That's if I have a ponytail.
Thank you. A couple of things. It reminds me of a quote. There's a guy, he's an architect. His name is Corbusier. And Corbusier had a quote that God is in the details.
Yes.
Okay? And this is no more pertinent than it is in facelift surgery.
Right.
Okay? So, you know, I don't know if I'm a fast surgeon. I don't know if I'm a slow surgeon. I don't know. It's irrelevant to me. Okay? But it's like these little tiny things, you know, like that kind of maybe perturb me. You know, for example, we made another video about a lady who we changed the incision on her because of the fact she needed it. Allie. We changed the incision because of the density of her hair. She was a primary. Like, I would have loved to have done that. If I did your primary, I would have done that incision on you, just because of the way your hairline is. Okay? And behind the ear, you want that incision to fall into the crease, not onto the mastoid.
Exactly.
You don't want the little hairless bald spot back there.
Yeah.
You know, I mean, it's like the, and you know, I'm not going to come here and say I was born perfect. That's not true. I've done my share of surgeries and go, that one needs to be even better. But that's why you do it out at 20 years, you go, okay.
Right.
And even now, I find little tiny dinky things to do to go, I want it better.
Right. Yeah, it has to be, what I'm finding is Dr. Offrey tailors it to you. You know, it's not one size fit all, you know, like
it never
when I
is.
came in here and I put on a pair of slippers and they gave me a size 4. So
and you're like, I can put a big toe in there.
And when she actually brought them to me, I put my hands in. I said, that's the size of my hands, okay? My feet are much bigger than that, and we had a good laugh about that. But what I'm saying, just like anything else, the surgery has to be tailored to you. And I feel like right now, based on what I have seen in the mirror, what I can see, you know, I'm 67 years old, so I can't look in the regular mirror and look back there and see. You got to get me some big lights and some binoculars. But from what I can see, he seems to have tailored my hairlines, because I do like to wear my hair short. I like to change up. And I'm excited about what I can see so far.
Yeah, you barely have any scars.
Yeah. I'm like, how is this even possible? You know, and like I told him, I said, you have the hands of God. He got me straight right there. Let me know there's nothing perfect, but I'm just saying how God has tuned his hands to each individual patient.
Well, thank you.
I'm grateful.
Well, thank you, Vivian. You made my day. This is the day before Thanksgiving, so I'm kind of giving this away, so I don't know when I'll post this, but these are the things I'm thankful for, you know? And first of all, yes, I believe that there are people that I don't know how I sat here and deserved to get my gift. I got my gift. I'm thankful for it. Everybody has their gifts, right? You know, everybody has the things. And the other thing is I have amazing patients, you know?
You do.
And
personality too.
Well, no, what I mean is my patients are amazing. It's you guys, you know? And like yesterday, I literally had a talk with the lady who runs my website. And she goes, I don't know how your patients sit there and talk to you on camera. No other surgeon that I work with has patients. They always tell me, oh, my patients don't want to say anything. My patients don't do anything. And I was like, I just asked them. They go, okay, it's cool.
Yeah, I work with kids, teenagers, and when they see this and I go back to work, they better not say a thing.
Otherwise, you're going to give them detention.
You're going to get detention.
All right.
Students. So Vivian, patients or students? I meant students.
It doesn't matter. I think everyone got your mojo. All right. We'll see you next week. Yes. All right. And then we'll do another little follow up. We'll have a couple days for you to kind of really chillax and do your thing.
Yeah.
Awesome. Happy Thanksgiving.
All right. Thank you, too.
So I got Vivian here, and Vivian is 4 weeks, about a month. Revision, deep plane face, deep neck, lip lift, fat transfer. We took out some implants of your cheeks and chin. Oh yeah, time flies when you're having fun. You don't remember all these things.
I do, I feel it.
So, hello Vivian.
Hi.
Okay, so I'm gonna comment a little bit on her, what I see. So, since she's a revision, overall I think she looks great. She's still a little stiff. You can clearly see there's still some amount of deep tissue swelling, which is going to go away, but you're back to work.
Yes.
Yeah. And so you're doing all the things you're doing.
Yes.
Yeah.
Maybe too much.
So that's awesome. And she told me earlier that I'm not allowed to ask her how old she is, but she's going to volunteer the information.
67.
She does not look 67, which is awesome. Lips look great. I'm glad you listened to me and allowed me to do your lips.
The lips. I love the lips.
Okay, so I have lots of questions for you. Okay, number one, how do you feel?
I feel great. I mean, physically, I feel great. Emotionally, mentally, I feel great. There are days when I'm still processing all of this because I'm not back to normal in my facial expressions yet.
Yeah, so as you can to everyone else who's watching this video, you can clearly see she can wiggle her nose and smile and do all these little things. Okay, so all the nerves are working, muscles are working. It's just that when we do revisions, these tissues are beat up from the first surgery and then they get beat up from the second surgery. And actually in Vivian's case, and then we did the reconstructive surgery about 10 days later, 2 weeks later. So she got kind of beat up twice, right, in a short period of time. So all those tissues do need some time to really kind of come home, you know, and just relax. But everything's working. She looks great. I mean, I think you sent me a photo of you in your 40s, if I'm not mistaken, right?
Yes.
Yeah.
40s. Yeah. It was in my 40s.
Yeah, I'm going to search my records to make sure I still have it because pretty damn close to that.
I forgot what I looked like when I was 40.
Yeah, it's been a little bit, huh?
Yeah.
A few things just have happened since then. She was telling me also, and I'm not afraid to share this, that she's got a little bit of pain in her kind of high cheekbone area. And hold on, keep doing that. Do that, yeah. So that area right there, because that is where I tack down my deep plane.
And I could tell that I must have a deep pain because I didn't feel this the very first time.
So to anyone who doesn't remember Vivian's story or didn't see the whole portion of her journey, whatever, let me recap. She had surgery before. She thought she had a deep plane. That was what was told to her. Then she didn't like the results. We did surgery on her, and I told her she definitively did not have a deep plane previously.
Right.
And so now you can, this is something that I really want you, because you're a very interesting sample, Vivian. You are my third in a row that I did in a very short period of time. You want to open the jacket just a little bit for your mic.
Oh, I'm sorry.
Yeah, there you go. Yeah. You're the third in a row that I did like over the course of like 6 days or 7 days.
Okay.
That all of you gals had the same story. You thought you had a deep plane, didn't like the result, came in, we did revision surgery, had a deep plane, okay? So I really love to hear, compare and contrast what you feel now, compare and contrast to what you felt then, because I think this is really important.
Okay. The very first time I thought I had a deep plane.
Yeah.
This is when I had the implants put in. Of course, that was the first time the chin and the cheek, I think they stood out more. So, you know, when you're a patient, you don't know if what the doctor has done under your skin. So I never really felt this kind of discomfort in
soreness.
Here. Yeah, so to compare and contrast, I didn't feel that, although it was over 14 years ago, about 14 years ago, I'm beginning to see, okay, why am I having so much going on here? And I didn't feel it then. You know, I just looked a lot different, you know, for a good while. And then I had the cheek implant, and I didn't like it because after about 2 years, I began to see the shell of it. And then I started getting a little bit of jowls. I couldn't understand why was I getting jowls so early? So I went to another doctor, and he did a revision, and he said that he had just cut the little chin out, and I think he did a mini facelift on me.
You just tighten it.
He just tightened it, right. So, but this time, this is the full shebang. You know, I'm like...
Feels different.
Yeah, it feels different. When I say pain, it may be, now if I touch it, my husband got close to me and he touched it and I could feel that pain.
Like, is it like soreness, or is it like 10 out of 10 that you go, oh my God, I can't live? 3?
It might be a 5 out of 10. But it doesn't last. It's not something that all day I'm having pain. You have to touch it. For it.
So if you leave it alone, it's fine.
If you leave it alone, it's fine. I might get a little tingle of something I could feel going through my body. Now, I'm supposed to do a little bit of massaging and rub. I can't do that on a dry skin. You gave me some soap, and I put it in water, and I let it gel. I can massage it, and I don't feel any pain at all. As long as it's moist, I can put pressure on it.
Perfect.
But just dry, no.
No, I don't need you to do it dry.
Yeah.
But I really like, okay, so this is very interesting to me because, so when you did this, do it again, there you go.
Right in there.
Yeah, because that is exactly where I did the dissection.
Yeah, okay.
The deep plane comes, and then this is where your bone is.
Right.
And I take a big, nice bite of the tissue over the bone to hold that flap in place.
Right.
Okay, and you can feel it.
I can feel it.
You can feel it. I mean, there's no lying about it.
Yeah, I can feel it.
But that is, so if we take a look at Vivian here, look at her, if you take a look at her cheekbone, she's got really, really sharp cheekbones, okay? And she's got this, like, I mean, she doesn't even have to wear blush. You can tell her cheekbones, just the way she's built. So this is one of the things I really wanted to accentuate on your surgery, okay? Because that's what makes Vivian Vivian. Now, somebody else wanted to accentuate it, but didn't complete the job, and how they accentuated it is stick some cheek implants in there. I want to do this au naturel, and I think we hit a home run on that. So we really gave you back, and this is why you're still a little sore in there. If you were a first timer, I'd say 80% of that soreness would have been gone by now. Okay? It's just because we've been dinking around in there a couple times. I mean, because within 2 short weeks, I dunked around. That would be a great word, the past tense.
So.
Dinked, okay? But to take out the implants, and that required some manipulation.
I'm glad those.
Okay? And you know what I was just noticing as we were talking? have you noticed that your chin looks different now? It looks more natural.
It looks natural. It looks a lot more natural. It's not.
It's softer.
It's soft. It is soft. I wonder why did I have a chin implant in the first?
No. So remember when we were doing surgery, I was telling you, this is my little personal experiment, my personal idea. So when we took the implant out, I agree, the implant was too much for you. But one of the things that was happening on you is that your chin was starting to do this.
Yeah.
And that's why someone stuck the implant, okay? And then so what I did is I said, okay, let's take the implant out. And what I did is I just put a little bit of fat in there to soften that area, and look at your skin, look at your chin. It looks easier.
Yeah.
I mean, I don't know what the best word in English is, but easier sounds, it just looks more suave, a little feminine. You know, it didn't look too,
Yeah, it began to look like Dorothy the Wicked Witch of the West.
Or Jay Leno. Little Jay Leno.
Yeah, it was beginning to, I would look at it and I would see, especially when I'm driving, and I look in the mirror, I'm going like, is that the mirror? Is that the way my chin actually looked? But all along, I began to see as I began to age, and I guess you would call it ptosis when everything started falling. Then
it's the nicer word is droopy. Much nicer word of droopy. When you say droopy, it sounds bad. So ptosis is a much more elegant way.
It's an elegant way.
Yeah.
So as it started, then I began to see the chin wasn't moving though. It was still there. And
it's like rock.
Yeah, the skin was dripping over, and even with the cheek implants, I can begin to see that something wasn't right. And I was glad. I wasn't thinking taking them out. And when I walked in and you said, you look kind of hard, and I saw that, but I didn't know to say that, I think.
So one of the things, and you can comment on this, I'm gonna throw a little teaching in for the people watching this. So to people out there who don't know me, I'm a pretty blunt instrument.
Very.
Okay, and I don't mean to be hateful or hurtful or anything like that. However, when I saw Vivian, in my head, I can see what the final result is gonna be. I still, she can't see it. And there's no way I can explain that. That's part one. And part two, I can see the delta between where we are and where we need to go. And as I told you before, one of the things in my thought processes, I am really becoming the dude that is au naturel. I like it. I like the way the muscles move au naturel. Now, am I saying implants are wrong? No, there's sometimes I have to use implants in someone who has no chin. I get it, okay? But in someone who has a chin, who's lived their entire life and is relatively happy with their chin position, I really don't want to do some of this more artificial, hard. I like a softer look.
Softer look, right. Right.
Okay. And we can explain this now, but at the time, Vivian and I had met each other for a grand total of 4 minutes. She tells me, hey, these are my problems. And I just told her, hey, I think you look hard, and this is the reason why, and this is my game plan. And this is something I do with my patients. I tell them what I see, and I just give them a blueprint. And this blueprint is a moving target of things that I may need to do in order to achieve the vision that I'm looking for. And you can correct me if I'm wrong, if that's kind of what you went through.
Yeah, I think that you are a doctor who is real. You're not giving me what I walk in and I say I want this, then you say okay. You're
I don't know how to do that.
Yeah, you're just real, and I appreciate it because I don't always know what I need. I'm looking at what I want, but I don't know how to achieve it. You know how to achieve it. And even with like the lips, for instance, I'm like, okay, don't, and you're just gonna okay. I say, okay, now I'm happy. I still have to adjust to the lips because sometimes the lips, when I chew, my mouth is moving differently than it was. I have to be careful. I told my husband, I'm drooling, let me know.
But so there's two things I really notice now that I want to make some, like even so then before when I saw you. Number one, when you're talking, okay, and you're just generally talking, even just when you just said, okay, I can see a little bit of your teeth.
I know that.
Remember? And you said, I really want to see, I like my teeth. I want to see a little bit of my teeth. You can see just a few millimeters of your teeth. So that's the first thing. And I think it looks very youthful.
Okay.
Yeah. The second thing, and you've changed your hairstyle, but you know what's really cool? This is what I really like about you, okay? So one of the things, when you do a revision facelift, okay, and I'm gonna drop it like it's hot, and you're doing a revision facelift on an African-American lady, Okay, for me, there's a little bit of tension because we've got to really hide these incisions. Skin that has color has a little bit higher propensity for issues with healing and all these kinds of various things. And you've had surgery before. So I was like, okay, we got a couple of strikes against us. We've got to like own this. And 6 weeks after surgery, you got a girl who says, I'm going to chop off my hair. Okay. I mean, you got to admit it's a little, but you look great. You can walk around. Okay. Like if you turn your head, you can't even see the bloody incisions. Your earlobes look perfect. Okay. And we did that modification so that you even have a little bit of the sideburn here, and it doesn't change that, you know, so it looks really nice.
I love that part because I like to wear my hair tied back in a scarf. And one time I had it tied, and a person told me that it looked like I had cancer because I had no hair there. You know, I said, what do you mean? You know, and I didn't realize that all of my hair was off in this area, but since you did the revision, I'm like, oh my God, I have hair here. I didn't have any hair there. I have, and I told you, I said I like to wear my hair short. I let it grow out because my husband wanted long hair. That doesn't work for me. It takes away my liberty. Okay, this is free. I just get up, shampoo, and go. But then I was going like, this morning I put my gel on. And I was going like, I have hair here. I have hair here, and I can wear it short. That's what I love most about this.
So I want to make a point here, and this is, okay, and I use this example many, many, many times. There's a famous architect named Le Corbusier, and his quote is, God is in the details.
Yeah.
Okay? So when you do a facelift, it's not just about, okay, deep plane, yeah, go dissect, pull this. That's all there. But one of the things, in my opinion, and this is something, I'm better now than I was 15, 20 years ago. It's just continual improvement. You keep staring at people. Number one, women have sideburns.
Yes.
Okay? Women have sideburns. They have a little bit of hair. Even like if you look at a Caucasian girl, she'll have wispies.
Right.
Okay? Like you have a little bit. So if you lift that too high, it looks weird.
Yes.
Okay?
It did.
And so a lot of times I think when I see lectures by surgeons, okay, they'll always say, oh, she's got longer hair, it'll camouflage the incisions. You shouldn't have to camouflage incisions, because like you are the perfect example of this. You had this spot back here that looked like, you can point at it since they can't see me. It was right back there.
Right
that,
here.
Yeah, that she had no hair. And her hair line was going down. It went a zigzag in and came out. And it looked weird.
I don't know how you did this.
So, you know, it was very careful manipulation of all these little things to try and line that back up so that you can have your hair like this, walk around at Whole Foods, and nobody knows you've had anything done. Now turn your head just a little bit. The other thing that that side. Now look at her tragus, which is this little area right here. She's not done healing yet, but you can see it has already started having shape. Before it was kind of pulled.
Yes. You're gonna make me shout up in here.
Yeah, because it looked kind of wonky. I don't know what the word is, but it looked kind of like someone was like, there was a little man there yanking on it too hard.
Right.
You know?
I mean, this is the one, my lips, this part right here. This morning when I got up, I was like, oh my God. This is just, I just love it. I don't know what you were doing, but you did some things that I didn't know you were going to do. And when you said that you'll be able to wear a ponytail, I say, he thinks I'll be able to wear a ponytail. Well, he doesn't know I'm about to get scissors and cut all this hair off my head.
But I mean, it's just that I want you to be able to pull back and not have...
This is my pullback.
Yeah, but whatever that definition is to you.
This is my pullback.
Now, the next thing, I want you to recognize something. Okay? What you see in the mirror and what I see, two separate things. You just said this. You said, I like my lips and I like all of this.
Yes.
You know what I saw the first thing when you walked in?
What?
I saw your cheeks and I saw your neck.
Okay.
Okay?
Okay.
So what I see and what you see were totally different.
Okay. Yeah.
But we can both agree.
Like my neck too.
Yeah. But no, you don't have to jump on the bandwagon, but you see what I'm saying.
These are the things that point out, this is the problem that I had right here.
Yes.
And my lips would unfold under. And I did get some, one doctor had to get some, filler in it. And I looked so weird.
Yeah.
I wore a mask for the longest.
Yeah. So
They didn't do the job.
yeah, I mean, you look amazing. A lot of the things that and over the next, let me tell you your timeline.
Okay.
I think over the next 3 to 4 weeks, you're just gonna look a little softer.
Okay.
In my eyes, I think you still, like probably most people don't know you've had anything done. What do
Right.
people around you say?
Nobody says
Nobody knows anything, okay?
No.
In the next 3 to 4 weeks, you will feel a little bit more comfortable in
Okay.
your skin because it's just gonna feel softer.
Okay, yeah, I do feel tight right now.
Yeah, it feels, and I'm sure the neck, you're just getting used to that feeling. Probably till about a week ago, you can correct me, it still felt like someone was kind of strangulating you a little bit.
Right.
You know?
I mean, I still feel like that in here.
Yep.
In this area right here.
Yeah.
Yeah, but mostly it's in here that I feel like my face is not I'm not Vivian yet.
Yeah.
My smile is something, and it has to do with this part right here because I feel still tight in there.
Yeah. So, yeah, go live it, man.
Yeah.
Go rock it.
But I know what's going to happen. I know
You can see it now. You see my vision.
Yeah.
All right. As we end every one of these, open mic night, you have open mic to say whatever you want. 7.8 billion people.
Okay.
You've gone through it all. You've gone through the worst. You've gone through the neck pain. You've gone through the sedation. You've gone through all of this jazz. What do you got to tell them?
I think one of your YouTube you had on about revision, and then your patient was talking to you as you were having surgery. So I never comment on anything. So I went in the comment, and one of the people who were viewing said, "What in the world did you give her wherein she can talk while her face is apart?" And I jumped in and I said, "I'm one of his patients, and I'm 4 weeks out, and I'm tell you right now that what is happening there is real because I was able to get up and go to the restroom if I need to go to the restroom. I had local anesthesia with oral sedation. And I've had general anesthesia before. And I'm telling you, that was the best thing ever because I did not have the side effects that I had from the general anesthesia. I like going to sleep under general anesthesia. It makes you feel good. When you wake up, you had some good sleep. But I'm gonna tell you, that local combo.
The cocktail.
Yeah, I didn't feel anything. I don't know if I went to sleep or woke up or whatever from time to time, but all I know is that I felt good. I felt safe. I could hear the conversations. I could go to the bathroom if I wanted to. You could go to eat your lunch if you wanted to. The whole thing was a very great experience.
It's easy for you.
It was very easy for me. I didn't have to have pain medicine. I did take pain medicine for a couple of days
afterwards,
just because I wanted to make sure I would be okay. And then it helped me to rest, took off the anxiety or whatever. But for the most part, it was an experience that I thought I would never have. And like some of the viewers think, how are you doing? It works. It was a very awesome experience. Healing is taking its time. I got to get used to this face. I'm still here. I got to get used to the smile, and in this area makes me look a little, but it's all great. And then you did things that I didn't know you were going to do. You saw something that needed to be done, like my hairline. I had no idea. I said, oh Lord, I'm going to have to probably wear a wig.
But I don't know how to do it any differently, Vivian.
When I see it, I just be done. No matter what we talked about, you did what needed to be done. Like the lips, hairline, it's just blew me away when I woke up and I was able to wear a ponytail. Then I said, I'm cutting this stuff off because now I actually have
You feel comfortable in your skin.
Yeah. So this has been awesome, and if I had to do it again here, I would do it again.
Thank you. I appreciate that.
I really would.
So thank you for sharing that, because what you give me is the confidence. Like sometimes, I mean, I'm not being an egoist. I think I'm good at what I do. Sometimes there's a little fear factor of, hey, you know, because when we talk and I tell you, hey, listen, at the end of the day, this face is my face. I'm not kidding. Okay, there's no joke in that. I'm being very serious. And so when I'm in the operating room, anything that I see that I think can be made better, I will attempt to make it better.
And you did that.
Right?
I got some surprises. I got I got a birthday gift every night, you know, with this hairline. Yes.
Awesome. Well, I'm really glad that everything went great for you. I'm glad everything healed well. You know, whenever we do surgery, we do the best we can. There's a little bit of this, like, I hope it all goes okay, and you've come out through the other side, and everything went great for you. And, you know, you're rocking and rolling, living life, looking like you're 30-something, you know. So It's been awesome. I mean, I'm honored you chose me, and it's been a absolute honor. So thank you. And
I'm so glad I'm here.
thank you.
I'm so glad. When I moved to Houston this summer and I saw you, I've been following you for a couple of years at least. And I'm going like, he's here in Houston? Oh my God. I had an appointment with another doctor. I was going to go back to where I came from. And when I saw that you were here, I told my girlfriend, Dr. Arthur is here in Houston. I never paid attention to your location. I said, okay, I made an appointment right away.
Well, thank you. I appreciate it. It's you have no idea. This is what makes us smile.
Yeah.
And everything that you have said to me is really a great honor to me. But one of the people that don't get the accolades are all the girls around me, right? So they rock.
They rock. All of them.
Yeah.
I'm telling you, it's like a family up in here. Okay?
It is.
They're not overly anything. They're real. They're just like him. They are real and loving and professional.
Yeah.
I feel like I was in good hands with it's 1, 2, 3,
4.
4. That's all they need.
Yep.
And they're here. I mean, they're like dependable.
They are my family. So they literally some
they
of these.
act like family too.
Oh yeah,
They talk like family.
Absolutely. Some of them are my in case of emergency. So yeah. They literally are my family. So
and you're accessible. That's the thing about it. Most doctors hide in the back. From the very first time I walked in the office, it's like you can't see them. They're not touchable. But the very first thing, he's standing behind. I think it was Barbara. Cutting up, acting up. I'm like, I really like this person because you were approachable. That's what I did like about you. You're very approachable. When you walk through here, talk to my husband, and this is a good place, y'all. I'm not being paid to say this, okay?
Well, thank you. I really appreciate it.
Yeah.
It means a lot to us, and so we aim to keep getting better. That's what life's about. Is just put one foot in front of the other and make sure that the next foot that you're about to place is better than the one before.
Nice little cute office, clean, very clean, pristine. I love it.
Thank you. I appreciate it, Vivian. I wish you the best.
All righty.
Merry Christmas.
Christmas, Happy New Year.
Happy New Year. I will see you next year.
Yes.
Okay, and we'll follow up with her probably in a couple months, see how she's doing, and give you her update.
I'll be looking fabulous like I am now.